In recent years, the term neurodivergent affirming practices has gained momentum, often mentioned as an alternative to traditional applied behavior analysis. But when the two are examined side by side, you may find that many of the strategies championed in neurodivergent affirming practice often overlap with what is taught academically in ABA. Let's explore some of the differences first. Neurodivergent affirming practice are led by those with lived experience. It emphasizes the voices of neurodivergent individuals with low to no support needs in receiving and providing support. In contrast, after receiving a formal autism or other qualifying diagnosis, ABA services begin with and are monitored by standardized assessments. The recipients of the services are wide-ranging, but typically full-time hours would be dedicated to students with high to moderate support needs. ABA practice emphasizes structured skill development. In order to measure behavior change, we use curricular assessments. Using these, we target skill acquisition by many ways, such as discrete trial training and natural environment teaching. This is where the two approaches begin to overlap. Both practices are supposed to champion client dignity and autonomy. Both approaches prioritize self-determination and respect individual choices. On compliance versus function. Neurodivergent affirming practices rejects compliance-based models. This approach moves away from compliance training and focuses on autonomy and assent in all circumstances. Neurodivergent affirming practices resist behavior shaping that reinforces conformity. Meanwhile, in ABA, compliance is taught, but not blindly for compliance's sake. Instead, they're shaped based on social significance, safety, and instructional purposes to teach behavior cusp. When selecting target behaviors, ABA focuses on identifying and addressing the function of behaviors by utilizing extinction and teaching replacement behaviors simultaneously. In both practices, informed consent for parents and assent for recipients are considered core ethical values. However, the manner and extent to which these are obtained may vary depending on contextual factors such as legal age, cognitive and communicative abilities, safety considerations, and the professional judgment guided by ethical standards and practical realities. Another thing that is shared is that both use positive supports, as in they both aim to utilize positive reinforcement rather than punishment in shaping behavior. It is widely encouraged to try to make sessions client-led as much as possible. When done ethically, ABA's goal is to reduce risk and increase quality of life, and that's something both models agree on. Many clinics that advertise neurodivergent practice as a counter to ABA often allow for qualitative data. This means subjective information, third-party feedback, self-reports, and anecdotal info allowed to account for desired behaviors. As many of the clinics that fully utilize this methodology, with the exclusion of ABA, do not accept students with severe challenging behavior, such as aggression, self-injurious behavior, or pica, quantitative data tracking is not prioritized. In contrast, ABA relies on data-driven decision-making. It's a research-based model that uses measurable goals and objective quantitative data to track progress. While sometimes it can appear off-putting to narrow behaviors down to specific functional definitions, it is necessary to measure failure or progress, and is common in the medical field. It is necessary to know what a thing is or isn't. And ABA is not just for children. Different forms of ABA can be used well into adulthood for work-life balance and community social engagement. Let's examine the core philosophy of the two. Neurodivergent affirming practice does not view autism or neurodivergence as something to fix, rather as a natural diversity. Instead of expecting autistic individuals to change, it emphasizes the importance of acceptance, understanding, and creating environments that accommodate and respect their unique ways of thinking and communicating. Whereas ABA acknowledges that for some individuals, especially those with higher support needs, intervention can be necessary to reduce harm or increase independence, quality of life, and future outlook. ABA uses evidence-based practice. Even though it's individualized for the learners, treatments are only used that have been researched and peer-reviewed to be effective throughout the last 50 years. Another thing that both have in common is that both promote self-advocacy. One way this is done is by prioritizing learner communication based on preferred method, including verbal, gestural, written, AAC, texts, etc. to express desires and needs. What's shared here is the idea that the learner leads their own narrative. Neurodiversity affirming practice is often driven by community-led advocacy, rooted in grassroots movements and self-advocacy groups. This reflects a bottom-up approach, where support is shaped by the needs and voices of those directly affected by it in some way. In contrast, applied behavior analysis, ABA, is guided by a top-down model, professionally regulated by graduate-level clinicians and governed by certifying bodies such as the Behavior Analyst Certification Board, BACB. These structures are in place to uphold ethical and professional standards through licensed oversight. The BACB ensures regulated ethical standards are in place and that behavior professionals are also required to follow the BACB Certification Board Code of Ethics, ensuring high standards of care. Neurodivergent affirming practices are powerful and growing in influence. Research on their effectiveness, particularly when used independently of traditional ABA techniques, is still emerging. Many of these newer models began appearing around 2010 and continue to be studied to determine the effectiveness of components that differ from those traditionally taught in applied behavior analysis. In contrast, ABA has a longer established foundation rooted in evidence-based practice. While treatments must always be individualized, ABA only employs strategies that have undergone rigorous peer review and have been shown to be effective over the past 50 years. While outcomes can vary from learner to learner, any approach used within ABA must be supported by prior evidence demonstrating success with the same or similar behaviors, and its effectiveness must be validated through ongoing data collection. Another thing they both share is that both uses natural motivation to guide learning and skill building. Both approaches recognize that motivation matters and that interventions are strongest when guided by the learner's actual interests. Because neurodivergent affirming practices reject compliance-based models, there is a strong emphasis on normalizing and not interfering with self-stimulatory behaviors or stemming, recognizing that attempts to suppress them can cause distress or encourage masking. ABA has also evolved in this area. In quality ABA programs, practitioners are trained to avoid targeting self-stimulatory behaviors unless they pose a risk of harm or significantly interfere with learning or meaningful social engagement. When such behaviors are addressed, the goal is not elimination but rather teaching alternatives or setting appropriate boundaries, respecting the learner's needs while supporting functional growth. And that brings us right back to client dignity and autonomy. Respecting autonomy means respecting the whole person, including how they move, stim, or express themselves. It's important to remember, autism is a spectrum. Some individuals with neurological differences move through life with minimal support. They advocate for themselves, they live independently, and they don't see their differences as deficits. For them, the idea of behavior change can feel unnecessary or even offensive. But that's not everyone's experience. There are also individuals whose needs are much higher, who may not be able to communicate their wants, who may engage in self-injurious behaviors, or who might not be safe without structured support. ABA, when done ethically, is built to help those individuals. It doesn't assume something is wrong with them. It is helping to provide them with opportunities to learn skills that can be generalized to community safety, independent living, and higher communication based on presenting deficits outlined by the individual and their medical diagnosis. This is where some of the tension in this conversation comes from. In 2013, the release of the DSM-5 expanded the diagnostic criteria for autism spectrum disorder, ASD, to include a broader range of presentations, such as what was previously diagnosed as Asperger's syndrome. As a result, many individuals who may not have qualified under earlier criteria were now eligible for an ASD diagnosis. This change not only increased access to health insurance coverage, but also opened the door to services such as ABA that families might not have previously considered or pursued. And that shift created a disconnect. People with very different needs were suddenly being offered or subjected to the same kinds of interventions. Some of those interventions weren't appropriate, and some left people feeling misunderstood, overcorrected, or even harmed. We don't dismiss that. Those stories matter. But we also can't overlook those for whom ABA is medically necessary. Some families come to ABA because they've run out of options. And for many people, it's made a real difference. Whether it's learning to ask for help, use a communication device, or stop a behavior that was truly dangerous. If you're wondering whether ethical ABA or neurodiversity affirming practices are better, the truth is, when done right, there's a lot of overlap. A lot of what's considered neurodiversity affirming is just what ethical ABA should already be doing. But if you're asking whether ABA is right for you or your loved one, it depends. It depends on the person's ability. It depends on their needs. It depends on their goals and many other environmental and biological factors. ABA is going to shape behavior. That's what it does. This is the same for many other social institutions. When it's done ethically, it does so in a way that is socially relevant, person-centered, affirming, and backed by decades of peer-reviewed research, not to change who someone is, but to support the potential of who they can become.